everybody. I'm Pastor Chris Harris from Bright Star Church Chicago in the greater Bronzeville area. And I want to welcome you to today's episode of Clergy and Clinicians. For those of you all who are new to our show, this series is about helping folks understand the health issues that directly affect them. And the questions are being answered by many of the leading experts at Northwestern Medicine, physicians who look like us. Today, we're going to have a very real, very honest conversation about something that is obviously on everybody's mind, the COVID-19 vaccine. There is a lot of misinformation out there about the COVID-19 vaccine, and there's a lot of hesitation about getting it. So we've called on experts to help educate us about what's real and what's not. Today, I'm super excited. We have two very special guests with us today, Dr. Stephanie Cox Batson and Dr. Babafemi Taiwo. Doctors, it is fantastic to meet you both, and thank you for being here with me today.
Hi, Pastor Harris. It's wonderful to be here with you today, with your congregation, all of Bronzeville, and I'm looking forward to a great conversation.
And thanks, Pastor Harris, for the invitation. I look forward to an interesting discussion with you and members of your congregation.
Yeah, I'm pretty pumped up about today's session because here we have an African-American male physician and we also have an African-American female physician. So everybody's going to learn something, and I'm super excited about it. But before we dive in, could you both just take a moment and give us a little bit of a background about yourself, starting with you, Dr. Cox?
I have been at Northwestern for many years. I actually trained there as a resident when I finished my medical school at WashU in St. Louis. So Northwestern has been part of my life for more than 25 years. I'm contributing services faculty there. I still see patients. And in another part of my life, a very big part of my life, I'm the Chief Medical Officer for Near North Health Service Corporation, a group of federally qualified health centers in Chicago, serving a primarily African-American population.
Wow, that's pretty amazing. Thank you for all of your work. Keep it up. Dr. Taiwo, tell us a little bit about yourself.
Yeah, thank you very much. I'm originally from Nigeria. I trained at the University of Ibadan, Nigeria. And since moving to the United States, I trained in Massachusetts. I was at Duke for some time, and then completed my training at Northwestern. I've stayed on there for about 15 years. I'm currently the chief of the Infectious Disease Division. My work, most of the time, is really in the area of HIV, and like many of us, with the pandemic, we shifted our focus to COVID-19. And over the last year or so, I've been involved in the research, the patient care, and a lot of some of the policy things going on with respect to COVID-19.
Wow, pretty amazing, and thank you both for your work. And Dr. Taiwo, when I went to high school, my high school teacher, Dr. Sakiru Funsho, was from Nigeria. So I'm going to try to make sure that I get this right today. Hopefully he'll be proud of me. Let me tell you both thank you. We're glad to have you, and I know I personally have some concerns about the COVID-19 vaccine. I know members of our community do as well. And so let's get started with one of my friends from the greater Bronzeville community. Her name is Saida Segovia Taylor. She has a question for you all. Check this out.
Hi, my name is Saida Taylor, and I'm a Bronzeville resident here on the south side of Chicago. And my question is, in terms of racial inequities and historical context, how, as we, as people of color, how can we trust this vaccine and the process surrounding it?
Dr. Cox?
Yeah, the first thing I'd like to say is thanks for the question. And, you know, I think for a lot of people, when they hear African Americans having this hesitancy, especially non-people of color, they don't understand it. But it's a very justified concern when you look at some of the things that our people in particular have endured for the sake of science throughout history. And some of these things didn't stop until the 70s. University of Cincinnati was involved in some experimentation up until the early 70s. And of course, we all know about the Tuskegee experiments. And many of these things were done on prisoners who are disproportionately African American. So it is justified.
Right.
However, following that, there were a lot of policies and procedures put in place to ensure that this type of occurrence didn't happen again. Putting that aside, I'd like to talk about the emergency use authorization. I know that many of us think that maybe warp speed, corners were cut. That's really not the case with this vaccine. All of the same steps were followed. Thousands of people were tested before this was brought out to the public. 10% of those people were African American and approximately 15% were Latin American. So there was some African American representation there. I think we can feel very assured that this vaccine has gone through the same process as vaccines that we have taken since we were children. It's just that it was done more quickly because of the fact that we are in a global pandemic and a global public health emergency. The other thing that I sort of had to work my way through in trying to talk to my relatives and my partner, my husband, is that when they decided who's going to get this first, they decided healthcare workers were going to get it first. If this vaccine were really not well prepared, not well thought out, would we really be giving it to our healthcare workers first? And the doctors were first in line. This is a disproportionately group of people that are white, in general, more affluent, and on the front lines of taking care of us. So just when you think about it, if there was something wrong with this vaccine, I don't think we'd be giving it to that group of people to potentially knock them out. The other thing the public should know is the vaccine, when it comes in, Moderna in particular, it comes in a vial with 10 doses in it. When you get your vaccine, the woman in front of you, who could be white, could be Asian, we don't know, that same vaccine is now being given to you, an African American person, a person of color, or whoever. So I do feel like we can feel very safe in taking this vaccine.
I got to tell you, I really appreciate you. I want to just say this, that there are so many people who struggle with believing any clinician. And I think the benefit of this kind of conversation is it comes from folks who, again, live like the rest of the African American community, look like the African American community. And I think it's fantastic. But the misinformation piece is a really big deal. You know, the book that I preach and teach out of, it says people perish for the lack of knowledge. But messaging is important. Language is important, as well as translation. When you don't put it on the bottom shelf so the babies can reach it, it's hard for people to understand it. And so I thank you both for taking the time to make it relevant to those who live in our community. Another colleague, individual who not only is a member of the congregation, but also works at Bright Star Community Outreach, serving these community members. She has a question that I believe is something many of our community stakeholders are worried about. Check this out.
So I have friends that are in my community that are very concerned about whether or not they will receive the same quality of vaccine as opposed to someone from a different community. How do I reassure them that everyone is receiving the same quality of vaccine?
Excellent question.
In terms of different qualities, they're really, if you take any of the different vaccines, so you take the Moderna one, for example, there's only one kind of Moderna vaccine. And if you look at the other vaccine, another one, Pfizer vaccine, there's only one Pfizer vaccine. And there's only one Johnson & Johnson vaccine. And so the quality of these vaccines really don't differ significantly. They've all gone through this rigorous test that we're talking about, where upwards of 40,000 people were evaluated. And some got the real medication, some got something that was not, did not have the active medication. And in all situations, the results showed that the vaccines were effective. And so these are all good quality vaccines. And if one is trying to think about, oh, which one should I go after? Should I go after the Moderna one or go after the Pfizer one because one is better than another one? The answer is the right vaccine for you and for me is the one that is offered to me. because those that is available to me, because these are all good vaccines, good quality, and I think you can rest assured based on what you heard from myself, I hope, and also from my colleague, Dr. Cox, that a lot of work went into this. A lot of, no corners were cut. And these are really good quality vaccines that should serve the Black community very well.
So if I would take the risk of just giving a little bit of pushback here for the sake of the community, one, based on my understanding, it takes probably 3 weeks between the first and the second shot. Then they say another one between 4 weeks. And then there's even a narrative out there, 6 weeks. What's the truth? And if they're the same, why the different time frame between the time that you take the first one and the second one? Dr. Cox?
Yeah, so first of all, we have right now, I don't want to say readily available, but right now we have two vaccines that are primarily out there. We have Pfizer and we have Moderna. Both of these vaccines are vaccines that you need 2 shots to receive the full benefit. So when we get the first shot, between then and when we get the second one, there is some benefit. We're gaining some immunity, but it's not until about 2 weeks after the second shot that our body has had a chance to build up and make that full immunity that we need to combat the coronavirus. The Pfizer vaccine, the time period between the first and the second is 3 weeks. With the Moderna vaccine, the time period between the first and the second is 4 weeks. So they're very similar in that regard.
Pretty interesting, and thanks for that. And I hope that eases the minds of many of the people that are tuning in today. All right, usually as the preacher, I'm used to folks coming to me confessing. So now you guys are my pastors. So I'm going to confess something to you all. Historically, Black and brown communities have been hesitant to get any vaccines. And I, for one, am an individual who can honestly say for the first time in 46 years, I got my flu vaccine shot. Could not believe it. I was concerned. I was nervous. And because of my friends at Northwestern, I decided to take that step. And I'm excited that I did. I have another question from Akila, which surrounds this particular issue. Check this out.
So if you can get the flu from the flu vaccine, why can't you get COVID-19 from the COVID-19 vaccine?
Dr. Taiwo, I'm going to let you handle that one.
Yeah, sure. First, I'd like to congratulate you on getting your first flu vaccine after 46 years. It's never too late. And I hope it serves as an encouragement to your congregation. Now the pastor has gotten it, please listen to him. With respect to the question about why can't you get COVID-19 from the vaccine, I think we should start by clarifying something. And I want all listeners to really hear this very clearly. And it is that you cannot get the flu from the flu vaccine. That's a very important point because we, in clinical care, we often hear patients tell us, oh, I got the, every time I've taken the flu vaccine, I've gotten the flu. That cannot happen. And in the same way, you cannot get COVID-19 from the COVID-19 vaccine. And then let's go into the details. We have to look at the kinds of vaccines that are out there. The ones that are readily available that people have been getting are the Moderna and the Pfizer ones. Those ones, they're called mRNA vaccines. And the M stands for messenger. The RNA is just a big word for essential proteins that the body needs to function. And our entire body, all our bodily functions, really rely on these proteins to be made to tell us to, go in this direction, go in that direction. Make saliva now because there's food in your mouth. Close your eyes because something is going to enter your... Every bodily function really relies on these proteins that we're not aware they're being made, but as we sit now, proteins are being made in our body, giving instructions to our cells to go one way or do certain things. In the case of these vaccines, what we have are these messenger proteins that are designed, once they're in the human body, they go to the cells and they give instructions to the cells to make proteins that protect against COVID-19. So there is really no COVID-19 being given to you.
Okay, well, listen, check this out. When we come back, our friends from Northwestern Medicine, They're going to be answering some more of your questions. And let me prepare you doctors. Listen, we want to know, why is it so many people are giving COVID-19 vaccination and the flu vaccination the side eye? And many of them talk to me about side effects. That's what I want to talk about. And also, many of you are asking, PCH, did you get the COVID-19 vaccine? Guess what? You're going to find out before this show is over. We're taking a break, but we'll see you when we get back on today's edition of Clergy and Clinicians.
Today is relief and happiness. You know, it's a beginning to help us get back to normal. I got vaccinated because I want to be safe for myself, but I also want to be safe for others. I feel confident because I believe in the science of it, and the only way to get back to normal is through the vaccination.
I chose to get vaccinated because I wanted to see the end of this whole nightmare that has been COVID-19, and because I want to protect my family. I've got 2 daughters and my wife at home, and you know, I'm definitely thinking of them. I don't want to be the person that's the reason why they get sick.
So I came in pretty nervous, but also excited, understanding that people who look like me are hesitant to get vaccinated for all kinds of reasons. So having the ability to be vaccinated and share my story with my friends and neighbors and families in hopes that they will get vaccinated, it's a big deal. I'm always a big believer in knowledge is power. So I met with friends and family who are in the clinical professions, and I asked them questions. I did my research. I listened to the news about the vaccine, and then I took the first step and I came in here and got vaccinated.
Welcome back, my friends, to today's edition of Clergy and Clinicians. And I'm super excited. We're getting schooled today by 2 of the best, Dr. Taiwo and Dr. Cox. Now, you know, I look at TV at night and we see, take this medicine, it'll fix this. But here's what it says. But it may hurt this. It may break this. Here are side effects that may happen. And I believe that's one of the reasons why a lot of folks from our community give vaccines and medicines a side eye, because of the side effects. So I want to push you guys a little bit. If there is no virus in the actual vaccine, then why are people experiencing side effects?
Yeah, that's a great question. And I think what we all need to understand is that these side effects, and in particular with the COVID vaccine, we're seeing things like headache, body aches, when you feel a little achy. Very few people, only about 15% are getting fever, and that's with the second shot. But these side effects are your body's immune system turning on. And what I want people to realize is that the side effects are temporary. In general, they come on usually, if they're going to happen, around 12 hours or so after the shot, and they're usually gone in a day or 2. But the immunity, your body's ability to fight this COVID, is long lasting. So it's like a little investment for your future. That's really the way I think about it. But this is not the virus. You do not have COVID. And I think that's why people think with the flu vaccine, I got the flu because I got the shot and then I felt kind of achy and I had a headache. I had the flu. That wasn't the flu. You were not contagious. You couldn't give that to your grandma. It was just your body's immune system turning on to be ready for the future. So that's what's going on here. When I got the vaccine, I had a little bruise on my arm, was a little sore, but other than that, totally fine. The second time, because 2 shots, when I got my second one, I had absolutely no side effects whatsoever. Now, my husband, I'm married to a black man in Chicago. My husband, when he got his shot, he actually did feel a little tired and a little achy. And so his usual 75-mile bike ride, he had to cut it down. He could only do 50. So, part of that's because he's a really awesome guy. But the point is that the side effects weren't that bad. And, again, yes, it might be a little uncomfortable for a short period of time, but you've got this long-lasting protection. And this disease is really impacting our community. We cannot forget that. We are dying at a rate much higher than other segments of the population. And so we've got to protect ourselves.
You know what? That's an amazing response. And I'll be honest, I learned something when I took the flu vaccine. One of my good friends who is a nurse, she told me one of the reasons that a lot of folks start hurting wherever the injection is because they tense up. And so she told me, make sure that you relax, you chill out, and it'll be okay. And I did it, and it actually worked. I was pretty amazed. And kudos to your husband for going down from 70 to 50. Come on now, making the brother look bad. Dr. Taiwo, what was your experience with the vaccine? Did you take it, and did you have any side effects?
Right. I think I have to agree with you that Dr. Cox's husband did a fantastic job, right, going to 50 miles. And she took it with no side effects. And that is really not rare. Many people will get the vaccine and be completely fine. Now, we can't tell in advance who's going to get a little bit of side effects and who's not going to get it. And I'll tell you a little story about one of my nurses who told us that she wanted to take 2 days off after the vaccination. This was before she got the vaccine. She wanted to schedule 2 days off in case she got sick. And I was able to convince her to let's just wait. We have a lot of work to do. She had no symptoms. That is not to say that some people don't have symptoms. In fact, I did. And the symptom that I had was a rather uncommon symptom, which was the swelling of my lymph node. I got my first shot in my left shoulder right here. No fever, nothing, no pain. But a week later, I noticed a little bit of tenderness in my neck. So when I touched it, I had a swollen node. It took me maybe 5 minutes because I'm a doctor, because I've participated in the trials, because I knew this could happen, to say, oops, there you go. It's working. I've got my lymph node to prove it. It didn't get bigger, but it was a little tender. For a few days, it went away. In fact, by the time I got the second dose, it was gone. And I used to check it every, now and then. Now it's gone, and I don't worry about it. These side effects, like Dr. Cox said, will happen in a few cases. It's a sign of the immune system doing what it's supposed to do. And if it's bothersome, you can take some Tylenol. You can take some ibuprofen if you're having fever and chills and things like that. And finally, we know that sometimes these side effects are really not from the virus itself, or not from the vaccine, rather, itself. Because in trials, what we do is we give about half of the participants the vaccine. We give the other half what is called placebo, or sugar pill, or water. There's nothing in it. There's no drug. Consistently, some of the people who were given the sugar pill or were given the water come back and say, oh yeah, I have the flu, I got fever, I had chills, I had all of these things. They never got the vaccine, which means that some of the symptoms that we experience after the vaccination, they're not really related to the vaccination at all. And you can link that back to the experience when people say, well, when I get my flu shot, I had fever the last time I got the flu shot. Because maybe they had the fever, maybe they had chills, but it had nothing to do with the vaccination that they got.
Doctor, this is amazing. I got to tell you, this is the first time, and I'm so excited about this show. This is the first time I've ever heard a clinician say that sometime the side effect is proof or evidence that it's working. And I can't thank you guys enough. And I want to just take a moment to pause parenthetically and just talk to our viewers and tell you, if you're getting all of this information and it's informing you and inspiring you, you now have a responsibility to make sure that you share this with your friends and with your family members and those who are in your sphere of influence. We are learning so much today. There's an individual who is in our congregation, Lucretia Kindred, whose husband is also in the medical field. She have a question for you today that I guarantee you guys are hearing a lot of.
I'm Lucretia Kindred. I'm from the Bridgeview area, and I have a question about the vaccine. Do you think that we will treat the COVID-19 vaccine like we treat the flu vaccine and have to receive it on an annual basis? Or will the 2 doses that we are anticipating to receive now be good for the time being and moving forward in the future?
I can't wait to hear this answer. Dr. Taiwo and then Dr. Cox, take a piece of that.
Right. You really asked the question that we are also still asking as researchers, as doctors ourselves. The truth is, we don't know how long the protective effect of these vaccines will last. We know, based on what we know so far, that it will last for some months. Maybe it will last a year. Maybe it will last longer. The answer is not totally clear. And we have to be mindful of the fact that we're now beginning to see all this on the news, I'm sure. You're hearing about this virus mutating, about the UK strain, about the South Africa strain, about the Brazil, all these things going on. No evidence so far that these vaccines are not going to, the vaccines that we have are not effective against these strains. But it's a lot for us to know. I think this is the key message that you should hang on to. Our most important intervention now is to get as many of us vaccinated as quickly as possible today. Because that is the only way that we can prevent that virus not only from infecting another person, but from mutating into a way that it will make the vaccines less effective. So to all the viewers, to all the congregants, it's really time to let's buckle our shoes, tie our belts, whatever we have to do, however we can get it, get vaccinated, do it quickly, because if we can shut down this virus from dividing, from making more copies of itself, from going from Mr. A to Mr. B, that is the way to give us the best chance. But in terms of whether it will be something we'll have to do every year, we don't know.
This is just powerful. I got to tell you, I was so concerned when I saw that there are various strands and things like that. I was like, oh, man, we ain't never going outside, because it's so hard to convince people. Dr. Cox, what say you?
Yeah, first of all, I want to talk about the fact that we have these variants and these different strands popping up. This is something that viruses do. It is a living organism, and it's very smart. It's constantly changing and trying to learn new ways to get to us. As far as whether this vaccine is something that we're going to be one and done, we don't know. We don't have that information yet. If I was a betting woman, sorry, Pastor, but if I was a betting woman, I'd bet we're going to be getting another vaccine at some point in time, right? I couldn't say when, but, that's often what we do with our vaccinations. If you look back in your childhood record book, you're going to see plenty of times when you've had a booster shot, something to just boost your immune system back up to help, continue fighting this organism. So that is my guess, is that this isn't the end of it. But to reiterate, everyone who possibly can, if you have the opportunity to get this vaccine, it's like the golden ticket. Go get it. Because if we don't, as this virus has more opportunity to move throughout the population, that's more opportunity for it to change and become more difficult for us to fight.
Dr. Cox, you are too kind. Listen, if you're a betting woman and you're right, ask me for $5. I'll give you a little something to bet for me, too, so we can all win. My good friend Saida has yet another question for you. Please take a look.
Do we have any research that shows whether or not the vaccine affects fertility?
Dr. Cox, go for it.
Yeah, I'll take that one. So, first of all, I should say the vaccine was not tested in pregnant women or lactating women, which means women that were breastfeeding. However, there have been pregnancies in people that occurred after receiving the vaccine. Because this is an mRNA vaccine, this type of vaccine does not become a permanent part of us. It is not altering our DNA in any way at all. And so we have no evidence and do not believe that this is going to impact the fetus or fertility. In fact, the American College of Obstetrics and Gynecology, in conjunction with the ACIP, which is an organization that really evaluates vaccines, they have a statement that says any pregnant woman should not be withheld from receiving the vaccine if she is in the category of people getting it at that point in time. By the same token, they say if you are trying to conceive, you should not get the vaccine because you are trying to conceive. In other words, get the vaccine. It should not impact your fertility, and it is not going to impact the fetus to the best of our ability. There is a large data bank being collected of women who are pregnant. Many nurses think of the nurses who are pregnant that are getting the vaccine, doctors who are pregnant, and we have, I think, about 15,000 people in that registry so far. So we're going to continue to get information that way, but I would feel very comfortable, and I'm an OBGYN, I would feel very comfortable telling my patients who are trying to conceive, please get the vaccine. And I think the other really important thing to know is that what's more dangerous to your fertility and your baby is getting COVID. We do know that pregnant women are in the high risk group when they get COVID. Now, the good news is, by and large, if you're young and pregnant, you're going to do well. But compared to women that are not pregnant, if you are pregnant, you are much more likely to end up in the intensive care unit or have potentially poor fetal outcomes.
So as you all can see, we have some pretty smart, intellectual people in our community. Dr. Taiwo, what would you say to Saida's question?
Yeah, it's a very important question. And certainly in the clinical trials, persons who were pregnant, who were known to be pregnant at that time, were not allowed into the studies. And also efforts were made to prevent people from getting pregnant during the study. But as we know, as always happens, some people did get pregnant during the study. And looking at that population, the small population of persons who were exposed to it during pregnancy and got pregnant after the vaccination, we don't have any signal to suggest that it is not safe for a pregnant woman to take these injections. And in fact, we have a lot of experience with vaccination in pregnancy. And if you consider the flu vaccine as sort of a standard one that we're all quite familiar with, it is actually extremely important for pregnant women to get vaccinated. And I think the same is true for the COVID vaccine. And the bodies that have looked into this and make guidelines and recommendations do endorse the vaccination of women during pregnancy and also vaccination of people who are seeking to conceive a child.
This is pretty amazing. So, Dr. Cox, you mentioned two things a little bit earlier. Number one, why it is normal, respected, and understandable that our community is skeptical. And then you also talked about the fact that you had the challenge of not just being a clinician, but being a wife who had to inform your husband and being a family member who had to inform others in your family. Were you successful at doing that? And come on, teach the preacher what to say. What do we say to make everybody feel safe?
Yeah, you know, we had a lot of long conversations and discussions with even my extended family about this vaccine, and probably like many of the people listening to this, we've been impacted and lost family members due to COVID-19. My mother is 80-some years old, and she has cancer at this point in time. And we're all very concerned about potentially passing the virus to her accidentally, or her getting the virus, not from us, but somewhere else. So we had a lot of discussions about what to do about this. As a healthcare provider, I had made the decision pretty early on that I was getting the vaccine. I didn't want it on my head that I would, not do my part in fighting this pandemic, and also potentially giving it to my mother or someone else in the family. With that being said, they do say that once we get this vaccine, we still need to mask and physically distance ourselves. It does not mean that we are 100% certain we can't transmit it. But as far as my family goes, we looked at the data. We talked about the fact that thousands of people had received this vaccine, and there were no significant negative aspects to it. And so it made sense for us to do our part to protect our community and go forth with this. So I was successful. My husband got the vaccine. My 80-year-old mother who has cancer received the vaccine. I think that's another really important point, is that medical conditions are not reasons that you should not get the vaccine. Diabetics, hypertensives, people with heart conditions, none of this excludes you from getting the vaccine, and in fact, it makes it more important for you to get the vaccine.
Wow. Thank you so much, first of all, for your level of transparency. And secondly, we'll be praying for you, your family, and certainly for Mom. Needless to say, people are not shocked. The show is called Clergy and Clinicians, so I firmly believe that anything we can have, God can still heal. However, we shouldn't use our faith as an opportunity to be foolish and ignore the facts. Science matters. Research is important. And talking to people like you all is vitally important. We have yet another question from one of our congregants, this time from Dr. Tiffany Brown, who is in pharmacy work. And I want her to share her question.
Hi, I'm Dr. Tiffany Brown from the South Side of Chicago, and my question is, what are some practices that evolved in public health arena because of COVID that you would like to see continue post-COVID, such as hand washing, for example?
Let me tell you, this question is really important because, listen, I'll be honest with you. I think a lot of us are tired of the mask, and they are important. So here's my question on top of hers. When do we get to the place of no more masks, no more social distance? Come on, talk to us, Dr. Cox.
That's a great question. I had this exact same conversation with two other doctors yesterday, and we were talking about the masks and, when can we get rid of them? I don't think we know. I really do think that some aspect of this is here to stay. And if we look back at history, I loved, Pastor Harris, that you brought up hand washing, because there was a time when we didn't wash our hands between patients. And we would operate and then go right to the next person and operate and not even wash our hands. But we learned from that, and my suspicion is that masking is here to stay in some way, shape, or form. I'm not saying that you're going to wear a mask 24/7 for the rest of your life, but I think as a society, if we see somebody walking down the street with a mask on, we're not going to think, oh, what's wrong with them? We're going to understand and be respectful of that. In the healthcare setting, we might very well always be wearing masks. I don't think we know the answer to that yet, but I certainly wouldn't be surprised if that's what happens. The last thing I'd like to say is we can't get tired. This disease that we are fighting as a community, I know we're all tired of the masks. I know we're tired of not seeing each other, but this is like, the Super Bowl, and it's the third quarter, and yes, we might be up by 2 touchdowns, but the opposing team's quarterback is Mahomes. We cannot sit back on our heels and rest, right? We have to keep charging and run up that score as high as we can. And that's the way I feel about what's going on right now with this virus. It's not time to sit back on our heels.
Let me tell you, you keep this up, I'm going to invite both of y'all to preach so a brother can take a break. I'm trying to tell you, this is amazing stuff. And one of my favorite scriptures that says, don't be weary in well-doing, for you shall reap if you faint not. And I think it speaks to what you just shared. And I think it's vitally important that we make sure that we understand, yes, we've been in this for just about a year now, but what matters is not just ourselves, but those that we love and we say that we care about. I cannot thank you both enough. Before you go, is there anything else that you would want to say to our audience? A quick 30 seconds inspirational message to all of our folks. First you, Dr. Cox, and then you, Dr. Taiwo.
I guess I would say, please, if you have the opportunity to get the vaccine, get it. If you have questions and you're not certain, ask more questions of a respected, reputable person. Go to your doctor. Go to a trusted website. Northwestern's website has tons of information on it. CDC.gov has information. Use that. And And please do your part to protect our entire wonderful community. We, as a community, have to take care of each other. The responsibility is ours.
Yeah, thank you very much for the opportunity to come and talk today. I think it's important for us to realize that what we're experiencing now, it's something that is one in a lifetime event. In fact, it's more than that. The last time that the world had to deal with something like this was a very long time ago. And so we have to rise up and respond to the moment. The power of vaccines and vaccination has been demonstrated in the past. There are many diseases that have happened before that were eradicated only because of vaccination. And I think that we have an opportunity now to help ourselves, not just as individuals, but as a community. And I think that if you're looking at yourself and wondering, well, am I different? Why am I having doubts about this vaccination? Well, it's because you're human. That is a fact because people of different cadres, from different societies, different backgrounds, professors, intellectuals, everybody is asking the same question. But the moment you step back, you look at the evidence, you talk to people around you whom you trust, I hope that we come to the same conclusion that vaccination is really something that is necessary to save ourselves, to save our almost our civilization at this moment. And we should be thankful that we actually have it, because there could be an alternative, which is to have this rampaging epidemic or pandemic and have no vaccine to help. The fact that we have these vaccines developed in such a short time and available to us is something we should be grateful and thankful for and make the best use of.
Pretty amazing. Earlier during our show, I shared a confession, but now I'm going to share a revelation. You know, I always say this to our folks, never buy clothes from a naked man. And as I told you earlier, folks are asking me, Pastor, have you taken the vaccine? The answer is yes. My wife and I went and got our first vaccination shot, and we're quite excited about the second one. And so, my friends, let me tell you, I do believe that based on the information that I have received, my personal research that I have done, and the input of all of our friends, for example, today, it helps me to get to a better place. And I hope it'll do the same thing for you. I am sure that many of you have more questions. So to get more information on the COVID-19 vaccine and when you will be eligible for your vaccination, please visit the Chicago Department of Public Health website or the Illinois Department of Public Health website. I'm excited. I'm grateful. Dr. Cox, Dr. Taiwo, I really appreciate the both of you taking time out of your extremely busy schedules to educate us so that we can all make the right decisions for ourselves, our families, and our communities. And thank you, all of you, for watching another episode, an amazing episode of Clergy and Clinicians. Please share with other folks what you learned today, because as I always say, we are a village and we need to look out for each other. That's the only way that we'll be able to get on the other side of this pandemic. My friends, stay safe.